Welcome you all to Chapter 13, Social Emotional Development of Toddlers. Most babies begin life surrounded by people who meet all of their needs. Babies' needs are usually simple, so caregivers can meet most of them promptly. When their needs are met and their environments are consistent, babies develop focused attachments to their caregivers and in turn learn to trust the world. As babies become toddlers, three changes happen. First, toddlers find out more about themselves as individuals and about their world. Second, toddlers realize the world is not solely devoted to meeting their needs. And thirdly, toddlers' emotions become more elaborate, specific to events, and intense or strong. Toddlers are also directly sense the expression of others' emotions. Thus, during the toddler years, children develop self-awareness, achieve autonomy, and reach out to form social relationships with others. They also begin to show attachments and express emotions. These three interrelated developments serve as a preparation for the emergence of a truly social being. Self-awareness, or the understanding a person has of him or herself, begins to develop at birth and continues to build throughout life. A good sense of self-awareness is essential to a person's well-being. Without a sense of self, children cannot develop close relationships and adults cannot share intimacy. Self-awareness in the toddler years involves seeing oneself as a unique person, recognizing oneself like in a mirror, and developing early feelings of self-esteem. Around the age of 2, toddlers begin to see themselves as separate from other people and objects. Toddlers demonstrate their understanding of being a unique person in the following ways. They develop body awareness. They become more aware of their bodies and what their bodies can do. They begin to sense awareness. Toddlers know they can see, hear, touch, taste, and smell. They also develop gender identity, the ability to label self and others as male or female. And it's sometimes that's called gender labeling. They also develop object possession. They define themselves by what belongs to them. And that's often why we hear toddlers say mine all the time, because it's object possession. Family names. They can state their own names and the names of their family members. And lastly, they can assimilate their culture. They begin to notice the physical traits of their ethnic group and the behaviors and values of their cultural group. A portion of self-esteem involves feelings of worth, which is usefulness or importance. Infants sense how others feel about them from the way they are spoken to and held. Toddlers can also sense how others feel about them. Toddlers must feel loved even when they are difficult or make mistakes. If adults scold toddlers each time they do something wrong, toddlers will feel they are beyond being loved. With the help of caring adults, children develop good feelings of self-worth. The confidence a person has in his or her own abilities or competence is part of self-esteem. As toddlers achieve goals, their confidence increases. They can gain another aspect of self-esteem, which is control, which is the influence over one's environment of people, things, and events, by figuring out what works and what does not work. Adults who do not rescue toddlers from small frustrations too quickly are aiding a growing sense of control over outcomes and events. As toddlers make mistakes, try again, and practice what works, they will achieve autonomy. As toddlers develop good feelings of self-worth, confidence in their own abilities, and gain control in their environment, they are developing self-esteem. According to Erickson, social emotional development begins in infancy when babies learn to trust or mistrust. Babies whose needs are met and who have consistent environment develop a sense of trust. This sense of trust helps them as they enter Erickson's second stage of personality development, which is called autonomy versus shame and doubt. In this stage, toddlers are tasked with achieving autonomy, which is a form of self-governance in which children seek to do his or her own will. For most children, this stage begins sometime between 12 and 18 months and ends or is completed around 36 months. Autonomy builds on a toddler's expanding motor and intellectual skills. Toddlers are proud of their new skills and they want to use them. Because toddlers have much more know-how now than they did as infants, they feel very independent. The independent feeling comes from toddlers' increasing self-awareness of their abilities. Erickson explained autonomy as the toddler's feeling of being able to do some task without the help from others. He felt that caregivers should recognize toddlers' desire to be more independent and allow them to do what they can at their own pace. He also believed, though, that damage can occur when impatient caregivers complete tasks that toddlers are capable of doing themselves. Consistently criticizing or overprotecting toddlers leads them to feel like they cannot control themselves or their world. Erickson called this feeling a sense of shame and doubt. A child's attachment to a caregiver begins in infancy and is completed around 12 to 18 months of age. Attachment has its biological roots in survival, but it is learned by the child through correct, prompt, and consistent caregiving. A child shows attachment to his or her caregiver through attachment behaviors, which are seen when the infant or toddler feels stress or anxiety. For example, the crying that occurs with separation anxiety is an attachment behavior. Children are often attached to several people. Each attachment a child has is a positive force in his or her life. After 18 months of age, if attachments are secure, toddlers are more apt to cooperate even when adult child goals are different. When children who have secure attachments become adults, they will be able to calm themselves, be confident in their abilities, form lasting and positive relationships with others, and be overall well-adjusted people. Toddlers who get inconsistent care, regardless of the reason, develop insecure attachments. A lack of adult support leads toddlers who are vulnerable to the impact of trauma from any source. Because of trying so hard to get their basic needs met, they often lag behind secure toddlers in learning too. Insecure attachments are most damaging to a person's self-esteem and thus to his or her mental health. During the toddler years, children's developing abilities alter how they experience and express emotions. Due to their increasing intellect, toddlers' emotions become much more elaborate. They react to more stimuli than infants. They know more people to love and fear. They experience more events and can even imagine unreal things. Toddlers can better sense emotions in others too. Also, emotions become more specific. For example, they may fear a neighbor's dog, but love their own dog. Emotions become more intense as well, sometimes even overwhelming to toddlers. Due to the intensity of emotions and their increased motor skills, toddlers tend to express emotions physically more than infants. On the other hand, toddlers' verbal skills enable them to express emotions verbally too, if taught. Because of these new and improved abilities, children's expressions of love and affection, fear, anxiety, and anger change during during the toddler years. So, love and affection. Toddlers are still attached to their caregivers and express love and affection by wanting to be near them. They seek caregivers when faced with a strange situation, and this attachment seems to help other aspects of social emotional development because the love a toddler feels for their caregiver often extends to other adults, children, pets, that type of thing. Many fears that begin during infancy are evident after their first birthday. Fears increase quickly after 2 years of age because toddlers know more things to fear. They know of more objects and situations that can hurt them. Toddlers may also begin to experience nightmares around the age of 2 years of age as a way of dealing with anxiety. For most children, nightmares decrease in time. Another form of anxiety is displayed through separation anxiety. Older toddlers between 30 and 35 months of age show less separation anxiety than other children. Toddlers desire more independence and have a strong will. When defeated in their goal seeking behaviors, toddlers react with anger. A sudden emotional outburst of anger, or what we know as a temper tantrum, often appears during the second year of life. So, how do adults meet toddlers' social emotional needs? Meeting their needs during the toddler years differs from meeting their needs during infancy. Toddlers are no longer completely dependent on adults due to their advancing skills. As toddlers learn they can do more things on their own, they desire more independence. For toddlers to grow and develop and have self esteem, parents and caregivers must allow toddlers to do the things they are able to do. Toddlers, however, are far from being ready to be completely independent. They still need adult help in achieving goals. Adults also need it. Adults are also needed in setting limits. Parents that are still nurturing, they will soon kind of enter that authority stage of their parenting. So, how do adults and caregivers help children achieve autonomy? Autonomy is a very important part of developing a toddler's life. Parents and caregivers can help toddlers on this journey toward achieving autonomy by ensuring their safety and encouraging their efforts. So we have to keep them safe from harm. That's our number one goal, right? So we can give toddlers safe choices so they can begin feelings of independence and use his or her own skills. We should also redirect toddlers before they engage in a forbidden or unsafe action. Another way is to encourage, in addition to encouraging their safety, is to encourage toddlers' efforts at achieving autonomy. Caregivers can avoid excessive criticism or correction of toddlers by letting them make mistakes without scolding and by not making demands on toddlers that are too rigid for them to follow. Because of toddlers' newfound skills, they become very willful, very curious. They find it most difficult to delay gratification, which means basically to wait until later to get what they want. And also, they have very intense emotions. Toddlers need both attachments for protection and comfort, as well as for their growing autonomy. They will go back and forth between wanting to be totally independent and being totally dependent. Toddlers also need some freedom, and adults need to guide toddlers' self assertion, which is doing as one chooses rather than what others want. Giving toddlers choices lets them express their preferences. An example of this might be a parent who can let a toddler choose between two sets of clothes for the day. So you lay out two things and you say, okay, you have a choice. You can wear either this or you can wear this. They are also more willing to accept a firm no when they're given choices at other times. So if you're constantly saying no, 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 and never giving the toddler a choice, they're not will they become less willing to accept that no that very firm no, because they have not been given those choices. So through choices, toddlers develop autonomy and avoid those feelings of shame and doubt for their mistakes or doubts in their abilities. So because toddlers don't have self-restraint or the ability to control themselves, often do not know acceptable behaviors. Okay. So not only do we foster self-assertion, but we also have to teach obedience, which is acting within the limits that others set to help them understand what is socially acceptable behavior. The best way to teach obedience is to meet their needs and to not punish what they do wrong. There are positive ways to help toddlers learn obedience. One is by setting limits. Um, we have to teach them what is socially acceptable behavior by setting limits for toddlers. Limits keep toddlers safe and show them how to become more socially acceptable. Adults need to decide which limits are necessary, which is basically like choosing your battles, and whether the limits are appropriate for a toddler. Um, you need to make sure that when you're doing the reason that we keep those limits short and sweet, and don't sweat the small stuff. Essentially, that's what is meant by kind of choosing your battles. So when we set our limits, parents and caregivers need to remember that toddlers are pre-moral, which means they are not self-guided by internal values. They're just not there yet. So toddlers are 100% guided by outside rules, and they need help learning those rules. And we can help them learn those rules by modeling them, making them very simple as needs arise. Don't make them too wordy. Don't make them too long. Getting on their eye level with the toddler and matching our tone of voice with the level of concern um, of whatever might be happening. Um, like not yelling, but saying please, like just getting right there on their level, and don't ever yell when we're talking to the toddler. Now there might be some tone change and some inclination in our voices to express the severity of whatever it is that we're trying to redirect them from. And we can also encourage the toddler to use social referencing, which is essentially means evaluating how to respond to a situation by getting a social cue from a more experienced person. And we should always praise them. Tell toddlers when their emotions and their behaviors are acceptable. We're almost done. Toddlers also show a variety of emotions from positive to negative. They're all over the place. Because they have this broader range of negative emotions because of their increased intellectual abilities, lack of inhibition, immature language skills, they need to express needs and resolve conflicts. They need parents and other caregivers to help them co-regulate their emotions. The goal of co-regulation is to help a child develop a rather high level of regulating abilities by the time they are ages 4 and 5. A child's temperament becomes very much a big piece of this co-regulation and their ability to self-regulate. So parents and caregivers play a central role in the development of how a child develops that self-regulation. So once a toddler develops language skills, adult explanation is considered the best method of co-regulation. Like telling them the cause of your problem is you didn't put your toys away, so now you can't get another toy. I am so sorry that you're angry because you didn't come inside, so now we've got to sit down. I mean, like letting them know what that emotion is, but then justifying whatever their discipline or whatever your limit might be. Toddlers who have formed secure attachments know they are loved and protected, and in turn, they love their parents and other caregivers. Toddlers also show love to friends, and their loveys are like attachment items. Toddlers also begin to learn about empathy. Empathy is the capacity or the ability to recognize and identify with the emotions of others. And that is a really inborn kind of skill. Developing empathy skills, however, requires learning. Before empathy can develop, toddlers must begin to see the goals and emotions of others, which require which require understanding of self versus other awareness. Toddlers with secure attachments recognize that their parents and other caregivers have understood and accepted their needs. As we talked about earlier about temper tantrums, that is one of the ways that toddlers express their anger. Um, Most 2-year-olds have temper tantrums. Some don't, though. Parents and other caregivers can learn to handle tantrums by understanding the cause of the child's tantrum. Parents can avoid tantrums in some cases by seeing the situation from the toddler's perspective. Um, so maybe one way to try to avoid or prevent temper tantrums may be to meet the toddler's needs before involving the toddler in adult activities. Avoid making demands when they're tired, hungry, ill. Like that's one of those things about choosing your battles. Remove toys or play equipment that seem to frustrate them. If they get frustrated and throw a tantrum over, let's say, a certain toy, remove that toy so that you take it out of their environment and it doesn't cause that level of anxiety or frustration. Have enough toys to prevent boredom and duplicate toys that they can share with their friends so that there's just not one thing. So, like if you're in a daycare environment and you notice that there's just this one particular toy that all the children love, and so one person gets it and the rest of them throw a temper tantrum, then you're going to need to get some more of those choices so that you can head that off at the pass so that that does not become a reoccurring thing for children to throw down and have a temper tantrum. Give in on small demands, such as staying a few minutes later when their cousins come over or a few minutes later at the park. I mean, give in to those small demands to prevent those temper tantrums. That's kind of like one of those choosing your battles things. And then offer some help before they become frustrated. If you see them getting frustrated, insert yourself there. Offer some help to try to prevent that temper tantrum from happening. Of course, temper tantrums all need to be handled in certain ways. And if a child starts to have a temper tantrum, you just let it happen. Just let it keep on going. It's a form of release for the child. Of course, you need to stay nearby and don't try to reason with them. First of all, you can't reason with a toddler. Okay. And secondly, especially you can't reason with a toddler when they're throwing a temper tantrum. So don't reason with them and just let it happen. Don't, I think you probably should avoid, this is from a parenting perspective, certainly not a caregiver perspective because you wouldn't do this, but avoid spanking children when they are using that spanking as a punishment for temper tantrums. Tantrums, when handled calmly, often decrease during the preschool years because you're just calm and you're recognizing as a normal part of that self-regulation piece. So, if you get down there on their level and you just reason them through it after it's over, and then, like I said, be aware of what is causing it, then you can eliminate that stress or that anxiety from the children. Once everything kind of calms down, I think that's when you have to acknowledge as the adult or the caregiver the feelings of the toddler and show them some comfort. Like, I know you really wanted to stay outside and play, and I'm sorry you're so upset that we had to come inside. Acknowledge it, tell them you're sorry about it, and then hug them and say it's going to be okay, and then move on. That ends chapter 13, and I will see you next week. Make sure that you complete your assignment and your quiz for this week.